Good morning, everyone, and welcome to the Early Learning Advisory Council meeting. We're going to wait just a few minutes and let everybody in. We do have a really tight schedule today, so I'm truly only going to be waiting like 2 minutes, and then we're going to jump into everything. In the meantime, if you want to get a jump start on everybody, in the chat, if you would share your name, where you're located, your role, and our icebreaker question today is that today is National Night Out. It's a day focused on community and connection and neighborhood safety. So what is one way that you stay connected with your community? And I will ask this again in a couple minutes, but we're going to wait for it and let people hop on. Okay, everyone, we're going to go ahead and get started. Like I said, we've got a pretty full agenda today. So good morning and welcome to ELAC. I want to draw attention to our virtual meeting protocols for everybody. Just feel free to read through those. I would it be appreciated if everyone would change their screen name to the name that reflects who you are as an ELAC member or a member of the public. And then for our introductions today, we are asking your name, where you're located, your role, and our icebreaker question today is that today, August 5th, is National Night Out, a day focused on community connection and neighborhood safety. In spirit of that, what's one small way you like to stay connected to your community? So I will go ahead and introduce myself. I'm Tanya Hutton. I'm an executive team member, and I am located in Southwest Washington in Longview. And one way that I stay connected to my community is I take my dog for a walk every day. We take different routes. I meet so many people. He's a beautiful dog, honestly, and I get so many people stopping and talking to him about that, and then that just sparks conversation, and it's just a really great way to meet people. We've got a beautiful park here in Longview. So if you're ever in my way, check out Lake Sacagawea. It's stunning and beautiful and great to walk or bike or whatever. And I will pass this on to my colleague, Colleen, who will be doing the next section of the meeting.
Erin, is Colleen here, or does she have to step away?
I believe she had to step away. I don't know if she's been able to rejoin, but she had something come up.
Okay. Yeah, I'm happy to do this if we want to move forward. Oh, yes. Okay. So Colleen's not here. She would usually do this introduction section, but I'm really excited because our ELAC committee has a full executive committee, and they're going to do some really quick intros. Dre is, she actually wasn't able to make it in today, but she is holding the seat. She's an ELAC member holding the seat of the Washington State Women's Commission. And here's her bio, and we're going to go through each member, and each member will just come off mute and do a little quick intro. So next.
Hi, everyone.
Dr. Brian Nold, are you there?
I am. Can you hear me okay?
Yes.
Great, great, great. Hi, everyone. Good to be in space with you. I'm Dr. Brian Knows. I'm a Holding Hope mental health consultant that focuses on infant and early childhood mental health. Yeah, it's been great being a part of the board, and I'm looking forward to continuing to build on what ELAC has started. So thank you. Nice to meet you all.
We can go to the next one, and I think it's Colleen's, which she's not here, but she's our representative for the coalition. And what we're going to do is actually take all of these intros and share them in the chat so you can read more about the new executive committee here on ELAC. But we can go to the next member, Hannah. All right, I don't know if Hannah's here either. But let's go to the next executive member, which is Tanya. And Tanya, go ahead and introduce yourself again.
So it looks like it's me and Dr. Knowles. That's all you're getting today, unfortunately. But I'm Tanya Hutton. Like I said, I'm in Southwest Washington. I've been in Southwest Washington the majority of my life. I am an enrolled tribal member of the Choctaw Nation of Oklahoma, and I've been working with tribal communities for my entire career, well over 20 years in one way or another. And I'm also representative for the Southwest Washington Early Learning Coalition. I'm happy to connect if anybody needs any advice working with tribal families. So I included my email in my bio.
Thank you, Tanya. So this is the section where we do ELAC committee business. We have several documents to just review. Really, it's we're going to work through them pretty quickly because we have a very jam-packed agenda. And the first one is the meeting minutes. So all of these materials that we're going to discuss and share in the chat, we definitely sent out via email. But if you didn't get a chance to review your email, we're going to quickly go through them now. The first item is the meeting minutes, which is Jessica just put in the chat the link to the meeting minutes. So ELAC members, if you have reviewed the meeting minutes and approve them, we'll vote on the approval process. But I will give you like this one's the longest one that I will give you on. I'll give you like 5 minutes to review them. So I know people are still reviewing the meeting minutes. Does anyone have any questions on the meeting minutes from the last meeting, which occurred June 3rd? All right, well, let's vote on the meeting minutes. So ELAC members, if you approve the meeting minutes, feel free to use the hand signals in the chat. I believe they're under React. I don't even know where they are anymore. Or just, yeah, raise your hand. Or if you don't agree, okay, yeah, thumbs up, or raise your hand if you don't agree, thumbs down. Yes, thank you, everybody. You're helping me out here. Put them in the chat or put them on your screen. All right, I see thumbs up from multiple folks. Yes, thank you so much. I don't see any thumbs down, but I will give it a couple more seconds for members to vote on the meeting minutes from the June 3rd meeting. All right, great. So meeting minutes have been approved. Thank you so much. Okay, the next document that we are going to review is the state agency partner updates document. This is where we compile updates from our partner state agencies as well as our internal divisions, divisions like the early learning division and our licensing division. So here's the link. And if you're curious to review it, please do so. There's a lot of updates from the early learning division. And all of these are on our Early Learning Advisory Council webpage. So if you want to revisit, I will put the ELAC webpage in the chat as well. And if you have any questions, oops, wrong thing, sorry. Here's the ELAC webpage if you want to revisit any of these documents. But yeah, let's move on to the next one. Unless you guys have any questions on any of the updates listed on here, there's a lot of work around the staff qualifications work group. There was a special webinar that was held last month specific to this topic. So if you have questions on that, the recording is available online. And there's additional updates from the early learning division around complex needs. There's a lot of various resources on here around training, intervention, funding. So definitely check those out. And yeah, anybody have any questions or comments before we move on to the next document? All right, let's bring up the regional coalition updates. The coalitions provide us some updates on what's happening in their local communities. So it is here in the chat, the link to the coalition updates. And if any of the coalition representatives want to come off mute and provide any verbal updates as well, you're welcome to do so at this time. Kim?
Hi, my name's Kim Davies-Loman. I'm with the Peninsula's Early Childhood Coalition, PEC, and I realize we did not submit anything before, but I just wanted to share that our coalition has been meeting in a variety of ways led by our WCFC coalition and also community coalitions with really the goal over the last few months to better increase the connected tissue between existing coalitions and networks to ensure that we're all talking, that we're understanding even more where there are connections between what we're doing and also reducing duplication. Just right now in a time of such reduced capacity, there is additional interest, I think we've seen in our community to really understand how to leverage each other's strengths. And just a call out to others, we're always interested to hear what others are doing to be effective in this space. And we're particularly focusing on the intersection between health, the social determinants of health, and early learning as well as a focus area this month.
Thank you, Kim, for that update. Does anybody else want to share their updates with their local coalitions? All right, well, let's move to the next document, which is the feedback loop document. This is the feedback loop from the last meeting, which is June 3rd. There was a couple outstanding pieces around the health consultation presentation. And there was a question about the insurance work group. And actually, I do want to point to that one because we did receive information from our colleagues here at DCYF. The Office of the Insurance Commissioner is contracting with oh my gosh, I'm gonna butcher this word, actuarial firm, Davies Group, to conduct a study on the affordability around liability insurance. And they do want to hear from childcare providers. So if providers are willing to speak with Davies about their experience with liability insurance, the cost or availability, or if they had issues and got dropped off or whatever, please send us, we're compiling names and contact information. So please send them to our community engagement inbox, and we will work with our colleagues here at DCYF who will work closely with the Office of the Insurance Commissioner. Yes, here's our email address. So if you are a provider or you know of a provider that has experienced like a specific scenario around liability insurance for your site and you want to express your experiences, please let us know and we will compile your contact info and we will forward them to our colleagues here at DCYF who are working close with the Office of the Insurance Commissioner. Yeah, and then the last one was staff qualifications. We had a recent webinar. We had a special webinar around staff qualifications. There was a lot of questions, a lot of engagement. So if you're curious, the recording link is on there. And thank you, Laura. I will jot these down. So yeah, if you are here, you can put them in the chat if you are interested to be part of that Davies group study that they're doing on insurance. Put them in the chat or email us. Either works. Any questions on the feedback loop or any of the materials that we just reviewed? Well, dang, I actually went through that really fast because our next presentation is not till 11, but I'm wondering if our presenters are here and if they're ready to get started. And
We're here, Marlene.
oh, perfect. Okay, Dr. Brian Knowles, do you want to introduce our next presenters?
Yes, I would. So right now we are going to have, let's see, Nicole and Melissa go over the implementation updates for the budget 2025-2027.
Thanks, Dr. Knowles. So Melissa and I are going to go over, as Dr. Knowles said, the implementation update for 25-27, and we're also going to talk a little bit about fiscal year 26 decision packages. And as we're going through this, if there are things coming up for you that you're like, oh, I really wish that they would talk more about X, Y, and Z the next time they present on this, please feel free to drop that in the chat or in the Menti when we're done. I think we're really trying to work through what is the best way to present some of this information as we are moving through implementation, not only of reductions, but of other things that passed during this last legislative session. All right, so we'll go ahead and move into this. One of the things that I will just note as we're looking at all of these slides is that there's a lot of information on here, and I'm not going to read through everything for you all. I'll pick a few things to highlight, but know that these slides will be available for you to take a look at as well. So this one is a chart highlighting the early learning bills that passed. And some of these pieces we're actually going to go into a little bit more detail later on in the presentation as well. So there are some things around adjusting age requirements for ECAP so that we're getting as many eligible children into ECAP as possible. Marlene highlighted the staff qualifications work group and the special webinar that you can go check out in regards to that. And then the other things that we have on here are just pieces that are helping with ECAP eligibility for families, really trying to ease the pathway for them. And then, as I said, Senate Bill 5752, I'm going to talk in a little bit more detail about some of the things that occurred in that bill. And then we have the Senate bill that made some modifications around childcare licensing for family home providers that are located off a federal military reservation and that are certified by federal military service. And so I would say the takeaway from all of this is that the teams across the agency are working really hard to implement all of these pieces of legislation that pass. So as we go into the next slides here, we're going to talk a little bit about some of the pieces that were related to child care subsidy rates and compliance with the Child Care Development Fund. So just to orient you to this slide, if you see some numbers in black, there was an increase there. If they are in red, that means that there was a savings that was assumed in that implementation. And so this slide again is focused on rates. And so we will implement the center-based rate increase on July 1, 2026. And that is when you'll also see some savings achieved by removing the hold harmless for a subset of providers that had rates that exceeded the 85th percentile of the 2024 market rate survey. And Matt Judge is going to be here in a little bit to talk about the upcoming market rate survey and cost of quality care survey. And I'll just put a plug in for that right now and just say, you know, that is going to be so important as we look at rates moving forward. And so we're really trying to streamline that process so we can get as many providers to participate in that survey as possible, because that helps the legislature set subsidy rates. We are on track to implement all of the pieces related to the collective bargaining agreement for family child care providers. And we were able to increase enrollment in healthcare by 177 additional licensed family home providers. And so just wanted to highlight that, but all of the rates and other pieces are on track to implement. The other thing we had was child care and development fund compliance. And so these are things like prospective payment and enrollment-based pay. Those pieces will take a bit more time, and the legislation acknowledged that. And so we're on track for a late summer 2026 implementation. On the next slide, what you'll see is some changes in eligibility, meaning dates were sometimes changed, or perhaps a co-payment or some of that was changed. And so This is just highlighting those working connections eligibility changes. And so the eligibility increase to 75% state median income will occur on July 1, 2029. Family co-payments remain the same this year. So those co-payment changes don't take effect until October 1, 2026. And then we had a change in the 12-month eligibility determination. And we are working as quickly as we can to implement that. But our estimated implementation date for that is March of 2026 at the earliest, but it could be March 2027 at the latest. And we really just have to be cognizant when we are making data system changes to make sure that everything's tested and works. And we also need to do things in sequence so that we can make this 12-month eligibility determination change and then be ready to do prospective and enrollment-based payment. And then working connection, seasonal childcare, all of those families are eligible for regular working connection. So that has been implemented as well. So on the next slide, what I will highlight is just some changes in the eligibility criteria, and in some places there was just some underspend. And one of the things that we have heard from providers is that having that eligibility expansion for childcare employees was really helpful as you were looking for folks to come in and provide that great service to kids and families. And that expansion in eligibility was removed for new applicants and reauthorizations as of July 1, 2025. As of March, we had over 2,300 families who were eligible for that reduced copayment. And when we last look at that, there was about 375 of those families who would be over income at reapplication. So the majority of folks who are accessing this will still be able to be accessing working connections, with a small percentage that may be over income at reapplication. I will go to the next slide and want to talk a little bit about ECAP and the ECAP slot reduction. So ECAP had a reduction of $60 million over the biennium related to the number of slots that were available out in communities to children and families. And we implemented slot reductions across all slot types and really tried to look at a way that would spread the mandated reductions across contractors to continue to preserve ECAP statewide presence. That did mean that 46 out of 62 ECAP contractors were affected. And part of why we needed to look at reductions across all slot types is that sometimes contractors voluntarily surrendered slots, or they said, we don't want working day slots anymore, we would like school day slots. And then we had some contractors who had slots that had never been filled. And that means that there had been no children or families who were ever in those slots. And so we did need to look at removing those slots. We also had requests for conversion from part day slots to school day slots. So moving from about a 3-hour a day slot to a 6-hour a day slot. And we honored those exchange requests at a 2-to-1 conversion, with the exception of some places where we were able to go in and take a look at that exchange ratio. You're seeing the words hold harmless here in a couple of places. What we really looked at is who were the ECAP contractors with 40 slots or fewer, and looked at maintaining their current service levels. We also had some contractors who also were doing early ECAP. And if you recall, funding for early ECAP was eliminated. And so we looked at their previous pre-K enrollment levels and looked at their school day slot adjustments. And then we have 10 communities that were really looking at some more direct connection and recruitment and outreach as it relates to working connections, childcare, and to state funded pre-K. And so we looked at those 10 designated catchment areas and kept contractors' school day slots at those levels to support BIPOC children's kindergarten readiness. They may have asked for voluntary reductions. If they asked for that, we did take a look at that. And then that still didn't get us to the 3,000 slots we needed to reduce by. And so any remaining reductions were applied proportionally across contractors. And then, as I shared, we did do some slot refinement as well. The next slide, I want to show you just highlights as I talked about those 10 districts and 9 counties where you may see some more, like I said, intentional outreach happening so that families have access to working connections or state funded pre-K. And this is just showing you those counties. This is really looking at ECAP in particular and where they fit within the ECAP priority group, if they had early ECAP, etc. So the following slide just shows you then the progression of ECAP slots from fiscal year 25 to fiscal year 26, which is right now. And so if you look at the line that says FY25 proviso level, in the FY25, we had 17,278 slots that were provisoed. In FY26, you see that drop down by 3,000 slots, and it is a significant drop in part day slots, where it says we need to put out at least 14,278. We were able to, with our final contracts, put out 14,395 slots, and you can see the breakdown by type in this slide. So really working to make sure that ECAP contractors have what they need as they are doing outreach and recruitment and enrollment for families to make sure that we can get all 14,395 of those slots filled for this school year. We want to go to the next slide. This is showing us some of what I just talked about in early ECAP, where you see at the bottom here that the funding was eliminated for early ECAP. And so the removal of those slots has occurred. In Eclipse, there was some underspend, and so the legislature just, they swept that underspend. Eclipse funding will still go out to 11 contracts for July 1, 2025 to June 30th, 2026. And Eclipse is early childhood intervention and prevention services. And the model that we have now really layers on that intervention and prevention on top of the ECAP slots that those contractors receive. We've worked on getting the complex needs funds out the door and all of the contracts that were eligible for them for ECAP contractors. And then the two things you see at the top are actually some increases. So in ECAP, there was a 5% rate increase for school day slots in FY26. And we were able to get that out in the contracts. And then we will be working through the process to award school day slots for the 26-27 school year. It is 250 new school day slots. And so I just want to be upfront in the fact that this likely won't be a big RFA to be bringing on new ECAP contractors that will likely look at those 250 slots within our existing contractors as we move into implementation. I'm going to pause there for a moment and just provide space if there are any questions about what I have gone through so far before I turn to some of the other reductions and what that might look like out in the field. Oh, and Lois, I see your question here. On the manual workaround for the childcare employees piece, so that is something that our childcare subsidy eligibility workers have the ability to do until we can turn off that eligibility piece. And we share with them basically how they can navigate through the system and get folks eligible while making sure that they have the same co-pays and everything with regular eligibility determination. And I think Jason's on. I don't know, Jason, if you want to say anything more about that. I mean, this was an expanded eligibility group, and we're really just taking it back down to how are we looking at our regular eligibility determination.
Thanks, Nicole. You got it right. Within our eligibility system, there's a series of radio buttons and drop-down options that allow for specific eligibility elements to be turned on. We're just training our staff to not engage those, so traditional eligibility is used for those families.
Yeah. And so Lois, I'm hopeful that that answers your question. I see it on the first slide here where we talk about that, and we're doing that for both childcare employees and registered apprenticeships. And it's basically having folks not click a button, as Jason was saying. So basically there was expanded eligibility, and now we go back to everybody is eligible up to 60% of the state median income as long as they meet the income and approved activity requirements. Okay. All right, so I'm going to share a little bit more about some of the other program reductions or eliminations. And I think, you know, one of the things I just want to note as we look at this is you're going to see DCYF taking a few pauses here. And sometimes we're pausing because we need to take a look at how we might be able to adjust training and enhancement opportunities for eligible provider types, or we might need to adjust how we're really prioritizing a certain group. And so you've likely seen some communication from us about trauma-informed care and a pause on some of those trauma-informed care enhancements for licensed family homes in particular, because funding was eliminated for center-based providers starting July 1, 2025. And so, you know, as we are working through that, we've paused those trauma-informed care awards for July and August. In dual language designation, funding was reduced for center-based providers beginning July 1, 2025. And so we're doing some work to look at how we support folks who had raised their hand and said that they wanted to participate in dual language designation. You know, really what is the next step for them, and supporting that commitment to dual language designation within the funding that we have available. So on the next slide, you're going to see some pieces related to some of our grants and complex needs funds. And so this is another space in equity grants and childcare complex needs funds where those 10 communities within 9 counties that I talked about with the ECAP reductions, you're going to see those come up in some other spaces as well. So, you know, while we're working on some more outreach in those areas, we also really want to think about how we can prioritize those communities as well when we're thinking about some of our grant opportunities. And so you see that in our equity grants, and then you will also see that in our complex needs funds. What I want to note about complex needs funds as well is that the tribal early learning grants were not funded. And so we're really working with the Office of Tribal Relations and others to think about how we take the prioritization that we had in place for tribal early learning programs and see if there are some additional things that we might do to support tribal programs in accessing these funds as the TELF funds have gone away. And then we had a reduction in our early learning facilities technical assistance fund. And so we are working on implementing that as well. So really implementing that with a reduced budget. So if we want to go to the next slide, and this is the final slide of reductions that I'm going to talk about. One of the things I'll also note on this is that right now we're sort of sharing how things will be implemented. I think when we come back and talk about this work, you know, there'll be some things that we can talk about around sort of what really is the impact that is occurring, for example, with infant and early childhood mental health consultation, going down to just 2 consultants in each child care aware Washington region and having the 1 bilingual consultant at the state office. So we can talk a little bit about sort of who was able to access those services now, what wait lists might look like, so that folks are aware of what that impact is. And then there was a reduction in our facilitated play and learn groups. And then we are working on, again, with OTR and others, what the tribal mental health consultation looks like for this upcoming year as well. And then there was 2 million added for Washington Communities for Children for their implementation, and that is on track to be implemented. So again, lots of information in here around implementation, both of reductions as well as, you know, doing some forward thinking about some of the pieces that were expanded or increased. And so as you listen to this or get a moment to go back and take a look at this, if there are particular things that you want some more detailed updates on in the future, please feel free to put those in the chat or to put them in the Menti or get them to the community engagement team. So I'm going to talk briefly about what this means for fiscal year 26 as far as decision packages, and then I'm going to turn this over to Melissa to talk about some agency requests legislation pieces as well. I think one of the things I'll just note as we talk about our decision package proposals is that we are still facing challenges related to the state budget, and there's anticipated federal funding impacts. And so we were really directed to focus budget requests on non-discretionary changes and legally mandated caseloads. So making sure that we were following caseload increases. If there was something that was a technical correction, meaning we needed to go back and update some assumptions, we were able to do that. Emergent costs or options to look at efficiencies, reform, administrative savings, or reduction. So those were some of the instructions we were given by the Office of Financial Management. And this is why you see a short list of what will be decision packages for the agency. It's also a supplemental year, and in supplemental years, we also don't ask for big policy changes. One of the other things I note before I will go into this is that the budget submission is still in process and it's subject to change until things are submitted to OFM, and then the Office of Financial Management or OFM will then make the final decisions around what is submitted in the governor's budget. So this is showing you a snapshot of some of the things that we had been thinking about. And the first one was supporting children with special needs. And this is something that we had been looking at because special needs rates have not been increased for quite some time. And, you know, when we were out doing our childcare conversations and visits, and certainly we hear in ELAC and provider supports and IPEL and other spaces, just the needs that are coming to you all when you're serving kids and families, and kids are coming with more and more complex needs. And one of the things we had looked at was, you know, how could we do a special needs rate increase and how could we simplify access for level 1 special needs? Given that those rate increases have a significant price tag with them, we will not be submitting that decision package. And I just want to acknowledge that we know that it is needed, but given the current budget situation, we're just not in a position to do that at this time. And then as we look at simplifying access for level 1 special needs, we are looking at some other ways we might be able to do that. So that we may not see a decision package from us related to this. So just want y'all to know that. The final two things that you see on here are what we would really consider a technical correction. And this is the forecast adjustment for implementation of Senate Bill 5752. And what we need to do is adjust the caseload impacts related to the timing of the savings for the change to the 12-month eligibility instead of 12-month authorization. There were some assumptions made about when that savings could begin. And as I shared earlier, it's going to take us till at least March of 2026, if not March of 2027, to do some of that. And then we also need to look at the adjustments for the eligibility period changes related to the 12-month eligibility for newly eligible families. And so know that those are two things you are likely to see from the agency that are technical corrections. And Capra, I see your question, and I think that is a great question. And I think there are some pieces of this that in the past have gone to the parent advisory group. And I think that is a good space for us to be able to take a look at that. As I shared, the decision packages in a supplemental year are often not big asks. They shouldn't be big policy level asks. And the two that are likely to end up going are about technical corrections. And I think it would be great to hear from you too, if there are other ways beyond parent advisory group that you think might be meaningful, or perhaps that's a question we can take to parent advisory group around what would be the best way for parent voice to inform our DPs. Okay. So I'm going to turn this over to Melissa, who is going to talk about agency request legislation. And you see the word efficiencies in here, which was one of the pieces where we had some direction around how can we create some efficiency. So Melissa?
Thank you, Nicole. It is great to see everybody. Beautiful morning. I know it's been a bit since being here. But for those of you whom I have not had the opportunity to meet, my name is Melissa Cheeseman. I am the Early Care and Education Government Affairs Senior Policy Advisor in the Office of Public Affairs at the Department of Children, Youth, and Families, or DCYF. Today, I'm here to present proposed agency request legislation, or ARL, that I am currently working on with DCYF leadership. This is agency-wide, but today will be you'll see everything that's being proposed, but what I'm really wanting to engage conversations or get collect insights and feedback is really around the early learning reports. Agency request legislation is a strategy, is a strategy that state agencies can use, like DCYF, to make changes to its authorizing statutes. Here, I really do want to gain your impressions or thoughts, so please raise your hand. If I don't call on you right away, you know, I will. And then also dropping in the chat would be really great also, questions. And I'm seeing here, okay, I'll reach out to you, Emily, if that's to me. Sorry, so just coming back to the proposal. So specifically, the proposal is to eliminate non-substantive, duplicative, or burdensome reports to achieve greater operational or government efficiency, with the goal of concentrating and improving DCYF's efforts to activities that directly relate to meeting our core mission. And I think the question you might all be asking yourselves is, how will your feedback be used in that development process? I think that's a really great question, particularly for those that may be new to this process. So the feedback, how I am going to intentionally use it, is to gauge the temperature and it directionally shape the proposal. And then to use the specific information that's being gathered to identify issues that I'm not seeing or issues in the proposal that need to be addressed during the development process. So engagement really helps outline what is not being seen by those who interact with the regulation either directly or indirectly. So as I'm going through this proposal, please consider some questions in thinking about providing feedback, like specifically concerns and questions related to the proposal, specific thoughts that you might have, and whether you oppose or are neutral or supportive. All of this type of feedback is really helpful in the development process, particularly, like I said, in identifying issues early on so they can be addressed. So I'm gonna pause before moving on. If there's any questions, thoughts initially. All right, as you can see, the slide, this should look pretty familiar for those of you who have participated in similar presentations. This is DCYF's annual legislative cycle. If I can direct everybody's attention to the yellow circle in the top left slide, this is where we're at. Again, we are in the process of developing decision packages and agency request legislation. This is an iterative process, meaning that one moment something could be in this process in the queue being reviewed, and at another moment, based on different feedback and guidance provided by our authorizing authority, these things can change. As Nicole just provided a great example, like the special needs rate. So during this time, DCYF staff, program, budget, policy, cross-functional are collaborating and working to develop decision packages like the three that Nicole was talking about earlier, as well as working on any requests that need to be updated based on like technical fix that came out of the last budget. Specific to this request, I will be presenting, like I said, agency request legislation to support our work. Additionally, DCYF is looking and working on policy and funding changes for the second half of the current biennium, also mentioned by Nicole, as we call this the supplemental year. So these are supplemental requests given the realities of our authorizing authority. So during this development phase, individuals like myself from the government affairs team will be working with advisory groups, community advocates, partners, staff in this agency and others if it's applicable, as well as legislators and staffers to engage and inform the proposal. Over the development and engagement, once this is complete, I will then complete the draft so that you kind of have an overview of the process. I will complete the draft. I work with internal staff around cost estimates, if any, and currently there are none for this proposal. I submit to an attorney general for an initial review, seeing if there's any legal issues that need to be pinned down and addressed immediately before submitting to the code revisor's office. This also ensures the proper format as well as all applicable content is included, and then obtaining an attorney general's opinion, legal opinion, a review of the actual proposal. All of this is then put together and packaged and submitted to OFM by mid-September for governor approval. The last thing I want to mention on this screen, or related to this screen, is ground us in DCYF's mission. Its mission is to protect children and strengthen families so they flourish. This is foundational and North Star to all DCYF programming. And this is also the center of the proposal for the agency request legislation, as it does support our mission by directing our attention to improving the quality of our practice through government efficiency and increasing data availability and accessibility through DCYF's websites and online dashboards. I'm going to pause now because that was a lot I just said. And if there are any questions, please let me know or drop it in the chat. All right, thank you for the next slide. And now I want to just go ahead and kind of walk through at a high level an overview of the ask. So we're calling this the report efficacy proposal, or DCYF's report omnibus, which is, like I said, agency-wide, seeks to remove or modify current reporting requirements through a two-pronged approach. The first is related to removing non-substantive, duplicative, or, I'm sorry, I said I keep bubbling that word, or burdensome reports to achieve greater operational efficiency with the goal of concentrating and improving DCYF's efforts to activities, again, that directly relate to its core mission. Second, this is only in one instance, we'll be requesting to modify a reporting requirement to better match data needs and gain, again, greater operational efficiency. The goal is to continue, again, through this initiative, the goal is to continue increasing data accessibility by moving required data reporting to online dashboards. I'm going to go ahead and drop in the chat a link to the current dashboards that are available. And I also want to plug, and we'll probably plug this several times during this presentation, that going live, I believe the kickoff for the Fair Start for Kids Act, Fair Start for Kids Act dashboards are going to be happening this month and likely this week, but more to come on that. So I'm just really excited about that, because there's a lot of data in there that's currently being reported in a report, but now will be more accessible in real time. This is work that DCYF is currently engaged in and working through. Like I said, the kickoff later this week. I'm going to pause there again if there's any questions about the dashboards and the link I dropped in the chat. Perfect. Thank you again for the next slide. This slide uses this slide provides the proposal's specific terms or rationales to identify reports that are eligible for inclusion in the report efficacy agency request legislation and the request to OFM. These terms and definitions are provided on the slide. Let me know if you have any questions specifically about those terms. The agency request legislation specifically just request changes that are technical in nature and are non-substantive to DCY's operations and its mission. The takeaway really is for the proposal is that DCYF wants to be able to make this data available online, and then also by increasing data accessibility, but also at the same time improving the quality of our practice through using our efforts rather than writing reports when you can just get the data available online. Next slide, please. So there is a correction to this slide. As I was talking earlier, this is an iterative process. And I'm going to drop in the chat the updated list for reports. So what you're seeing right now at the beginning of this work, as I was working through engagement, leadership, there have been reports removed, not from early learning, specifically to child welfare and prevention. So I've dropped in the chat the updated list. Like I said, no changes to early learning. So this slide, like I said, provides a list of the reports included on the reports omnibus. So at the very top, the top three are the early learning. On the top three left is the early learning. The bottom on the left is the welfare and prevention list of reports. These are all in statute. These will be included as of right now in the request. On the right side, these are the reports that are in the budget. Specifically, the one related to early learning, we're not asking to eliminate, which is related to the QRIS. Quality ratings, and improvement system. We're really just asking to report once a year and to align the reporting with the available data or the available funding through the federal funding, I should say. And so that would move it to an October reporting date. Currently, the proviso doesn't actually have a reportable date. It just asks us to report twice a year. Specific for the early learning statute changes, The first two come out of early achievers, both being due September 1st. The first one, early achievers, subsection 6, really looks at, and I've got some notes here. The data specifically in there looks at provider performance, support effectiveness, the support DCYF provides and its effectiveness, technical assistance and outcomes and retention data. A lot of these are a lot of information related to this type of, to the requirements in this reporting are already provided in the dashboards. And I'm going to go ahead and paste those in the chat for everybody to get acquainted with. Some of these are, you can pull Excels down. I was just double checking before this meeting. There are updates to the system, so maybe you won't be able to pull down Excel files today, but if you still are running into issues next week, just reach out and contact me. I will, my email is at the end of the slide, and I'll remember to drop it in the chat as well. So thinking about this report, thinking about the data that's already available online, our rationale for removal is duplicative, given the policy work that's already being done here, as well as the dashboards. The same is true for subsection 5 of the same statute. This one's called the cultural responsiveness report. This one is going to be published, I believe this year, is scheduled to be published this year sometime, as it is required to report it on every odd year, or every odd year. This one is, the data collected around this is specific to children served, right? And providers' demographics, as well as program quality metrics, family input, and expulsion rates. This data is also available online. And I'm working with teams to make sure we have all our all of the public's needs met around that data. With the last one, the Fair Start for Kids Act implementation report. This one is also due this year, as it's due September 12th of every odd year. This really asks DCYF to work in collaboration with ELAC on describing how the Fair Start for Kids Act's investments funded have impacted policy objectives stated within the requirements of that act. So specifically related to Fair Start for Kids Act, the terms of rationale that we're using for removal, one is burdensome, related because the underlining expansion for Working Connections childcare and ECAP entitlement have now been delayed out several years, as well as a lot of the underlining funding has been reduced and or removed. Additionally, we are saying duplicative because with the kickoff of the Fair Start for Kids dashboards, the data that's being reported or talked about in this report will now live online for individuals to access. Now I'm going to pause. I'm going to take a look at the chat and see if there are any hands raised, any thoughts and impressions. If there's something that's not clear, any additional information. I'm also developing a one-pager. I apologize for not having it done prior. There's a lot of work that has come out of this last legislative session, and I'm not going to make any more apologies in that. Apologies, though. I did wanted to have it done before this so that you would all have that in your hands. I do want to encourage anybody that if you don't initially have thoughts, to please reach out to me anytime. All right, hearing silence, we can go ahead and move on to the next.
Melissa,
Yes.
there is a question from Dr. Brian Knowles, and I believe you have a slide on this. If you can provide the examples of non-substantiated, I can't say the word, duplicative or burdensome reports.
Non-substantiated, you did it to me too. See, it's contagious. Non-substantive. If we go back to the list, can we go ahead and, perfect, thank you. Looking specifically at RCW 74.13.621. So this would be under child welfare and prevention, the kinship oversight report. essentially what this report is asking is for an update on the Kinship Care Oversight Committee activities. We are saying at DCYF that this is non-substantive. This is a non-substantive activity as it doesn't directly relate to protecting children and strengthening families so they flourish. Does that make sense? For burdensome, I gave 2 examples in the presentation related to the, no, I'm sorry. Burdensome was for the FSKA, in that the underlining funding and the delay in the expansion for Working Connections Childcare and ECAP make the underlining reporting burdensome, and that a lot of those funds are used for the policy purposes of advancing the Fair Start for Kids Act strategies and policy objectives. And without that funding, it makes it hard to advance those policy objectives. And then for duplicative, again, if the data that's being requested or information is being requested in the statute that we already have online or are scheduled to have online through a dashboard or through our website, that's what we're saying is duplicative. You're welcome. And with that, I'm going to go ahead and drop my email in the chat. Please reach out anytime with any questions or thoughts. I am working on the one-pager and I'm hoping to have it done by the end of the week. But as always, anything that I produce, I want to get as many hands and eyes on to ensure that what we're providing is succinct and provides the information that we really want to make sure everyone has the opportunity to really respond to. And with that, thank you, everybody. And I appreciate the opportunity to come here and engage with all of you. Again, please reach out anytime. I will, again, finish with my commitment to get this one pager to all of you as soon as possible, and hopefully before the end of this week.
Thank you to Melissa and Nicole. I would like to just grab your attention to the chat for a minute to fill out the meeting reflection survey. If you have time to send some feedback on the presentation that we just had. And before I welcome our next presenter, I just want to remind you to please type your questions in the chat as you have been doing, and we'll be happy to answer questions along the way or after the presentation. And now I would like to welcome Matt Judge. He's the Federal Initiatives and Collaboration Administrator, who will provide an overview of the upcoming 2025 Market Rate Survey, including its purpose, how provider input directly impacts childcare subsidy rates, and how to participate. So please welcome Matt Judge.
Hi, everyone. This is Matt. It's great to be with you again. This is the first time in a long time for me, so I appreciate the opportunity. I'm here today to talk about an upcoming survey that DCYF is going to put out covering the cost of quality care and market rates. It's through this survey and the data that we collect that DCYF sets its Working Connections childcare subsidy base rates, the rates paid to providers for the care that they provide to kids. And so I connected this work because in my role, I oversee several federal grants, including the Child Care and Development Fund, which is the federal funding that helps to pay those rates to providers and pay for early care and education benefits for Washington families. And on the next slide, I'll walk you through a little roadmap of the things that we're going to discuss today. First, I want to make sure that you all have good background on what market rate and cost of quality are and how this survey works and where it comes from. This will be review for a lot of you, but maybe new for other folks. So I want to make sure that we all get on the same page. Then I'm going to talk about some of the state legislative requirements that have come into play regarding the timeline for this study and the baseline federal requirements for a study of this type. And then I want to talk about the early educator design team, a group of providers who weighed in on some really significant aspects of the cost of quality care side of this equation. I want to talk about the priorities for this upcoming study, just some things that might be a little different from prior studies if you're a provider who's going to be receiving it, or just for your information. Then we'll talk about the timelines along which all this work is going to happen. And there will be a report at the end of the study. And so you'll learn about how all that'll work in time. Finally, I want to have a chance for y'all to have provide feedback on some of the things you're hearing, whether it's suggestions on how the survey rolls out, suggestions on how we encourage providers to participate in it, or anything else that occurs to you while you're taking a look at this material and listening to me. And I'll try to keep my eye on the chat for anything that comes up while we go along. If anything isn't making any sense or I'm going too fast, as I sometimes do, please stop me and I'll adjust. Next slide, please. So the first thing I want to make sure that I cover is the why around this. Why should we care about this survey that's coming up? So the most important thing, the very bottom line of this, is that we are going to set subsidy base rates, the provider payment, based on the data that we collect in this survey. So this survey is the thing that directly drives those rates and is an important part of the revenue base for early care and education providers across the state. So the legislature sets the subsidy base rates according to the market rate. That's the current methodology, and they outlined that in statute in this last legislative session. So it's important on an individual provider level because, as you might know, rates are based on geography and child age, and then we break those geographies into different regions, and different regions and child age groups get paid a different rate based on the market rates in those areas for children of those ages. So if you're an individual provider and there are only 5 other providers in your region, and if only 2 of those providers respond to this survey, it's just those 2 data points that are really going to help us determine what that rate is. And so it's important to participate in order to ensure that those rates really do reflect the markets in those areas, and that we have rates that support providers to thrive based on good data. So a low response rate, particularly in areas where there aren't many providers, can produce erratic rates that providers don't feel reflect the reality for them economically, whether it's, just for a certain age group or across the entire region, all age groups. So that's the market rate. Now, as I mentioned, this survey is also a survey of the cost of quality. So that's another methodology. States and territories are looking to move in that direction because we're seeing that the market and the private market isn't really supporting providers to thrive, in that families can't afford to pay what it costs to provide high quality care. Setting rates based on the market therefore perpetuates the market's inability to adequately compensate providers for the work that they do. And so states have been looking to move to a cost of quality basis. And Washington is one of those. We've done some legwork to be able to do that. I'll talk more about how these 2 methodologies intersect or interact in the next slide, I think. So cost of quality care versus market rate. I just kind of laid out the major differences. Cost of quality care asks providers, what does it cost for you to do your work based on all the different factors, what you have to pay your staff, what it costs you to rent your space or pay the mortgage on your space, other overhead costs, costs of quality pieces like curriculum materials, all of those things. Whereas the market rate strictly asks, what do you charge private paying families in your area based on the child's age? And then we set the rate according to that. Federal rules require the states to set the subsidy based either on a market rate or an alternative methodology. Cost of quality care is an example and the most popular example of an alternative methodology, an alternative to the market rate. So as I said, Washington is currently setting rates based on a market rate survey. That's how we've done it since before my time in this field. We have recently received federal permission to move to a cost of quality methodology. And we worked with providers and a vendor, Prenatal to 5 Fiscal Strategies, to develop a market rate methodology. So we have all of the foundational pieces in place, including that federal, permission to do it in order to make the switch. But the legislature is still having DCYF set based on a market rate survey. In this survey, we want to handle both sides so that whenever Washington State and the legislature deems we're ready, we can switch from market rate to cost of quality. And we have all the information about private markets and cost of quality at our fingertips to use either methodology or just to have good information about the state of childcare across the state. So next slide, I'll talk about some of the requirements here. To boil it down, for federal requirements, whether you're doing a market rate survey, whether the state wants to do a market rate survey or a cost of quality survey, we have to reflect variations by geographic location. So the difference in cost to provide care or market rate, say in King County versus Okanogan County, or whatever comparisons you want to make. We have to differentiate by that geographic location. Also have to differentiate by category of provider. The most obvious being centers versus family homes. We also have other types in Washington State, like school age only providers and outdoor nature based. So we want to be able to either group those into the other categories or differentiate them. And of course, we have to differentiate based on the age of the child, so that a school age rate is going to differ from an infant rate, and to some degree, to one degree or another, depending on the data. Another thing we're required to do is describe the level of participation in our Working Connections Child Care Subsidy program, meaning do providers accept families who pay through a subsidy like Working Connections? And if not, what are the barriers that providers face toward accepting it, whether it's, the rate's not high enough, or it's administratively burdensome, or whatever the reason may be. We're required to find out the why. If you're doing an alternative methodology, like the cost of quality care, which we abbreviate as COQC here, you have to analyze the cost of care necessary to meet the baseline health and safety standards, basically the standards for licensing, quality pieces, staffing requirements, and then the cost of higher quality care. Under Senate Bill 5752 that was just passed this last legislative session, we're required to do this market rate survey every other year. So if this one seems like it's coming up soon, it's because of this requirement. We used to do the survey every 3 years, which is the minimum frequency that the federal requirements have us do. The state is allowed to have a more stringent requirement than the federal requirement, and they use that flexibility in Senate Bill 5752 to require that we do this survey every other year. So that means that in that bill, they said that our next survey report is going to be due to the legislature June 1st, 2026. So last session with this bill just wrapped up. So we're kind of on a little bit of a compressed timeline to make sure that we meet that deadline and get a report out June next year. So those are the most important state and federal rules and laws that are governing how this survey happens. Next slide, please. So in the context of the cost of quality care, when we look at all the things that drive that, I already mentioned some of the things. The most critical one, of course, is what do you pay your staff? That's your biggest cost in early care and education programs. What should we assume about that when we determine a methodology for cost of quality care? What should we assume about other quality pieces, such as the amount of classroom preparation time a teacher is going to have? What should we assume about health benefits or vacation and sick leave that a provider's staff is going to have? What should we assume about the amount of time that programs have for their staff to participate in professional development opportunities? Depending on the kind of assumptions you have with this, your cost of quality care can be somewhat more than the market rate, or very near the market rate, or much higher than the market rate. So DCYF didn't just make assumptions about this. We went to a team of providers that Child Care Aware of Washington helped to assemble from an existing group that was focused on compensation in this field. And we convened over many evenings and I think a couple weekends to get their feedback on what we should assume about cost of quality care. So in a minute or later at the end of this, I'll drop a link so you can check out the recommendations at length. But what they recommended was really a pretty high quality, high standard for what the cost of quality care would entail. Most importantly, assuming a living wage based on MIT's published living wage standards, and then strong benefits, health, sick and vacation leave, for example, for staff in these early care and education programs. Strong, a lot of time for family engagement, which one example of that would be your parent conferences. A lot of time for teachers to plan their different curriculum and how they were going to implement it and plan their different lessons. Good education materials and evidence-based curriculum. Lots of time for staff to participate in professional development. A lot of those things require additional staff to free up time. You need maybe another floater in order for there to be adequate planning and release time. So that's another position. So all those things add up to costs. So they're assuming a pretty strong program in terms of what the subsidy base rate would need to be, how high it would need to be to support these things happening in programs. So that's the most critical set of inputs into our cost of quality care model. Next slide, I'll talk about all the pieces that make up cost of quality care. So hopefully this shows up, or maybe this is showing up as purple, straight down the middle there. Your personnel costs, like what it costs to pay your staff and their benefits, that's one piece that goes into the cost of quality care. Another piece of those quality enhancements, like the amount of time for professional development or lesson planning time, all of those pieces. The gray box there is kind of the area that this survey needs to gather data around. We don't have just assumptions around what it costs to rent your space that you do childcare or early care and education in, or what your mortgage costs if you're a family childcare provider. Your utilities are another one. All the pieces that go into your overhead expenses. When we're gathering data in this study, and it's to inform the cost of quality care side of this, it's the most important thing is that we learn more about those non-personnel costs in gray. Those three things come together to inform a cost of quality care model for subsidy rates. On the next slide, I'll talk about our priorities, things we've learned sometimes the hard way about doing these surveys and getting more data, more participation, and better data. So one of the things we struggled with in the 2024 survey is participation of school-age providers and making sure we have lots of data points to tell us what they're charging in the private pay world for school-age kids. So we want to we saw some technical issues in the way that we worded questions and the way that providers were moved around in the survey based on what provider type they indicated they were. And we want to adjust those things to make sure that more of those providers tell us their rates and other information. Like I just said, we want to make sure that we update overhead costs data, rent, mortgage, and utilities, and just get as many providers to participate as possible so that we get more data, more data points to make sure that we have an accurate understanding of those things. We're also strongly considering adding a data point to this instead of making an assumption about what liability insurance costs a provider, but asking them to give us their specific rate. Still to be determined whether we'll do that or not, but strongly considering it. We want to try to streamline this survey and eliminate any questions that either aren't critical to the model for cost of quality care or essential to understanding rates in the private pay world, or just data points that are really important for DCYF and the general public to know about early care and education that we just don't get other places. So if you read the last report, you'll see for the 2024 survey, we discuss a couple different ways to approach cost of quality care. Really, our model is based on that early educator design team's recommendations, and we only want to discuss cost of quality care in those terms, meaning the most robust terms, the highest level of compensation that design team talked about cost of quality constituting. So that will hopefully be a streamline of the report. So if we eliminate sections in the data gathering that are non-essential, then we can eliminate discussion of those and report in the report and get that report from around 60 pages, maybe closer to 30, so that it's more clear in its message and a simpler read for everyone who's interested in it. The report by its nature compares cost of quality and market rate because those two methodologies produce different rates. And it's essential for the reader to understand how they compare. We can clarify how we discuss those. I think that policymakers and just the general public would be less confused by this report than they maybe were with the 2024 report. So I think that'd be a good thing. I see a couple of things in chat. I'm just going to catch up on those. Susan, given that the increase in working connections reimbursements to the 2024 market rates for child care centers has been postponed, will the eventual increases be based on the upcoming market rate cost of quality care study rather than the 2024 study? I'm going to say that that's in the legislature's hands. We sat and had rates based on the 2021 market rate survey for a while, and it took the legislature's action to base the family home rates on 2024 study by ratifying the collective bargaining agreement. And they also set the schedule upon which centers would come into alignment with the 2024 study next year. So they'll be the ones to decide when rates are moved to be in alignment with the 2025 study. So sorry for the non-answer, but they hold the cards on that one. Jan asked, the market rate survey seems to be a highly inequitable approach to determining rate of care unless there are safeguards put in place. Where can we find out more about the process for this? I think the market rate survey itself, I'll post a link to the report on the 2024 survey is the best guide to how market rates are gathered and laid out and how this percentile analysis is the way it works. That's the best resource that I can think of for you, Jan. Other states also use a market rate that's the most prevalent methodology. So their surveys also describe it. And then there are the federal rules in place that describe it and some guidance. But I really think probably DCYF's market rate survey outlines the process and methodology the best. But I would agree, and I think most states have agreed that they would like to well, I'd say a lot of states have agreed that they would like to move away from the market rate survey, because analyzing the market rates does perpetuate inequities in the system, in that fundamentally the private rate is just based on what the market can bear, and families can't afford to pay what it costs to provide care. And therefore, we're just reiterating the inequity in the private market through the subsidy rate when we base it on that market rate.
Matt, to support you, if I've already dropped that report in the chat.
That's amazing. Thank you, Melissa. Really
Absolutely.
appreciate it. Kim asked, curious what provider survey participation rates historically are with that. What communication channels are used? How many reminders are usually sent? Great question. So we have trended around a little under 50% in recent surveys, but then the 2024 survey was closer to 25%. I think largely driven by that problem that I mentioned around school age rates. I will say that even at that 25% participation rate, that still provides a high level of assurance as to the data. However, as I mentioned, in those lower population geographic areas where there are just a few providers participating, it can lead to a limited set of data points by which to base the percentile brackets. And so that participation rate is significant. So I feel confident that we could get closer to that 40% or above mark by improving the survey. We send several reminders, email, postcards, and even reach out. We reach out by phone as well. What we do is just check in with our vendor, Western Washington University School of Business and Economics, I think it is, and kind of identify providers who haven't participated yet, and then kind of determine prioritization for reaching out. We also include an incentive. It was $100 in the 2024 survey. I don't know if that drives participation, but I think it is a way for DCYF to at least show respect for the time and effort required to participate in this survey. So the legislature didn't provide us, they didn't meet DCYF's request for additional funding to support this survey. So the amount of that incentive needs to be determined. So I'd love to keep it at $100 if we can find funds to do that. So that's to be determined. But those are some of the ways, the follow-up communications and incentives that we provide to try to support providers to participate. The last thing, it can be really hard to participate if you're a center with multiple sites and you have many, like some have a dozen or more. Doing a dozen surveys is not feasible for them, so we provide a spreadsheet. So I'm sure a spreadsheet doesn't sound like fun, but compared to doing 12 surveys, it is better. So that's another way that we try to make it feasible for those bigger programs to participate. And thank you, Melissa, for putting in those base rates. That's helpful too. So I mentioned under Senate Bill 5752 that the legislature expects this report by June 1st, 2026. That actually means that we need to deploy by October 1st. Need to get the survey in providers' hands because there will be the holidays. And then now that this is legislatively mandated, it also becomes a legislative report, and there's a lengthy review process. That's a good thing for the quality of the report, but it does mean that we need to do our work quickly. So we'll do that internal review between, in the spring of 2026, and that kind of pushes everything back a little bit. So we're developing and internally testing the survey right now. So far, DCYF has made some revisions and sent them to Western Washington University. And then I did the same presentation at Provider Supports. And they recommended that we have several providers test the survey. So I'll work with provider supports to identify those folks and get some actual provider feedback on what they're seeing to make sure that we didn't just miss something important. At the end of September, there'll be a communication and email to providers to hopefully prime them to be on the lookout for when the survey comes out. Let them know about the incentive, and just try to support them to take the survey. To avoid the winter holidays, we'll deploy October 1st, and then the survey period will be, October 1st through December, end of December, recognizing that end of December is going to be tough with the holidays and everything, but a good close to 3-month period for folks to respond to the survey. Then we start drafting the report in January, have some back and forth with Western Washington University on it, then internal review of the draft product between March and May, and then submit June 1st. That's kind of the timeline we're looking at. Yeah. On the next slide, I just have some questions for your feedback. These are kind of provider centric, I guess, and maybe not everyone here is a provider, but any feedback you have will be welcome. Before I go into these, I will take a look at this question in the chat from Laura. Is there any data on which provider types complete the survey? I think centers might be a little burnt out since it doesn't seem to impact our rates anyhow, since we're still based on 2023 through 2026, which is 3 years. So yes, we do post in the report what the different participation rates are between centers and family homes. I don't have it at my fingertips what the difference was the last time. And I empathize with the burnout. I can see that providers get tapped pretty often to provide important information because we rely on y'all. The only thing I will say is that the why is still really, really critical for centers, because this data is going to be what we're basing those center rates on. And it might not be, if the current experience is repeated, maybe those licensed family home rates change first, but the center ones will need to catch up. The federal requirement is that the state has to base its rate on the market rate survey, and one way or another, on one timeline or another, we are going to have to comply with that requirement. So, someday and in the not too distant future, center rates will need to be based on this data too, or we're not complying with the grant requirements. So there's still a really critical why for centers. And I hope the $100 survey goes some way toward expressing appreciation for the effort that it takes to complete the survey. Lois asks, hi Matt, can you share what are the requirements from Child Care and Development Block Grant on what must be measured in a survey? Are we hitting all the marks? Yeah, so talked about that a bit in the prior piece. So we are complying with all their requirements and then some. There's a few data pieces in the last report that aren't necessarily essential. For example, it's interesting to know providers' vacancy rates, but it's not required under CCDBG or Child Care and Development Fund to ask that question. And so that's an area where we might look to streamline just to, make it that much faster, that much easier to complete. Some of this information is helpful to know, but if we prioritize the response rate and making sure that the data supports the rates as accurately as possible, I think that points in a clear direction. But the base requirements are, if you're going to do a market rate survey, you've got to have those market rates differentiated. You have to find out from providers what they charge in the private market based on geography, child age, provider type. You have to find out what the rate of participation in subsidy is for these provider types and what the barriers are to them participating in subsidy. We've always fulfilled that requirement and will continue to. For a cost of quality care survey, you've got to measure the cost, again, differentiated by region, provider type, child age. You've got to look at the cost of complying with the baseline health and safety requirements, the cost of paying for your staff and under the required staff to child ratios, cost of quality pieces. So we're meeting all those requirements through our methodology and through the questions that we ask in the survey. So Lois, you ask also, so to streamline, why not go with prioritizing and have those questions as optional? We always have. The thing is, though, I think that when you have a survey that to go through it shows you all these pages and you have these optional questions and you have these mandatory questions, I still think that some providers can get dissuaded to participate just based on what it looks like when you look at this and what you've got to sift through and say, no, I'm not going to answer that too. So the fewer pages, the fewer questions, the better. Once a survey goes past 10 minutes, the participation rate starts to drop off. Everything that you do that makes it look like it's going to take more than 10 minutes is a potential problem in that analysis. So I think we need to prioritize what we really want to know versus what we'd like to know. And even if a question is optional, it can be a barrier to participation. So I like the thinking and I agree with you. And I'm still looking to streamline as much as possible, regardless of whether a question is optional or mandatory.
So Matt, if I may just, make that a little bit clearer, what I'm suggesting is, you do those surveys where you have your basic questions and then at the end, it'll say, would you like to answer additional questions? And folk can either opt in or out. That's what I'm suggesting, that it not even be part of the survey, that it be optional. And if folk want to, they can keep going. But if not, then you have, the majority of the information that you need. That's my suggestion.
Yeah, I haven't seen that or wasn't conscious of myself seeing that in surveys. And that's a cool idea. Feel bad that I didn't think about it before, but I will.
Yeah.
Western Washington
Well,
University
it's continuous quality improvement, Matt. So
exactly.
that is what, you think like Marriott, Delta, they all do that. Do you want to stay and answer a few more questions? And I think that would be helpful.
Okay, I'll ask about that.
Matt, we do have Colleen's hand up, and then after that, we're going to go into a break. And if there were questions, I think there were some questions in the chat that we didn't get to, we will definitely write those down and put them in the feedback loop.
Great.
Colleen?
Yeah, and feel free, Matt, if it's easier to provide this in the feedback loop, but my question was to have you elaborate on the requirements of the market rate survey and the compliance of like which year we're using, because it's my understanding we're still using the 2021 market rate survey to set provider center rates. And so, at what point in time are we out of compliance at the federal level by not using a more recent market rate survey? And if it is a very long-winded response, feel free to include that in the feedback loop rather than share now.
Yeah, rather than get into that, because I think I've gone over my time, I should respond to that via the feedback loop. Good question though, Colleen.
Well, thank you, Matt. We will have a break until 12:20, so about 6 minutes. And again, we will put the the meeting reflection survey for this topic in the chat, and please fill that out as you can. Thank you so much.
All right, everybody. The meeting break has ended. So welcome back. Hopefully you got a chance to get some coffee or something. But next up, we have Travis Hansen, Senior Administrator of Child Care Needs. And We have been working to improve and streamline the early learning provider application experience. And during this presentation, Travis will cover about the pre-licensing application process and changes coming underway. So take it away, Travis. Thank you.
Thank you. And thanks for having me. So as I talked through this slideshow, which I got yesterday. So this is probably going to turn into more of kind of a conversation. I'll go over some of the slides, but then I would like to answer any questions or any concerns. The other thing that I would invite you all to do today is think about when you became a provider, or if you were thinking of becoming a child care provider, what would you need at the front end as you were coming through the door? And probably we didn't give you what you needed, or there was some additional stuff that we could have done as you came into the system to better understand it. So let me just start into this and talk about what pre-licensing and how it's evolved. So pre-licensing, the idea of it originated because we started assisting with the grants, the facility grants. So back in 2017, we started to assist with those grants in the sense of from a licensing point of view, right? So we would come to the table and give assistance around that. And that kind of grew to this more of how can we assist folks coming into the childcare system. In 2021, you have the Fair Start Act, and it's how do we eliminate barriers, right? How do we get more folks into the childcare system, you know, which which then, you know, led us to even doing more with pre-licensing. So in 2022, pre-licensing, we created this unit. And the idea is that we wanted to give even more resources to folks coming into this to the system. It was very, very small. We started with a supervisor and some folks you know, helping out. And now what you'll see is it's grown into 2 units where we can support a great deal more of providers. So we are in 2025 right now and looking at rolling this out. So if we could go to the next slide. So really, when you think of pre-licensing, right? It's we're guiding folks on this journey as they come into the childcare system. This is before they even apply. This is prior to the application and submitting the application. This is way on the front end. So we're not going to recreate all the resources and everything is out there. Pre-licensing job is to truly partner and guide people in the direction that they need to go, right? So, you know, if that, for an example, fire marshal, right? We can connect them with the fire marshal early on at feasibilities, at, you know, plan reviews, different times to be able to get ahead of things. One thing that we have heard from a lot of providers that have gone through the system within the last couple of years, it's that there was a huge hang up with fire marshal and the communication and how we can streamline that. That is one thing that we can do with pre-licensing, is that we can really get ahead of that. You know, Department of Commerce, you have the grants. We can still help people with grants and what grants are out there and guide them in those directions. You know, finding resources in their community, you know, and guiding them to those. So really what it is us having those resources in our hand to hand them out to everybody. But not recreating this wheel, but finding all those areas and getting people connected. So if we can go to the next slide, that would be great. All right. So again, the original scope of pre-licensing was really to concentrate on grant recipients, you know, employment supported care, and organizational licensing. Okay. Um, you know, within the first 18 months, we accomplished a lot. We did a lot with the grants, you know, and reviewing those and scoring them. That's one thing that the pre-licensing does, is they score all the grants and help looking at a child care lens, right? From a child care licensing lens, excuse me. And really taking and being able to answer questions about providers, which is really helped with those grants. Merging the health specialists. So we used to have health specialists that were out in the offices, out in the field. We've now moved those folks underneath pre-licensing so that they can support on the front end. And then, you know, providing technical assistance, you know, to over 150 folks that were potential providers. And then the other thing that the pre-licensing group did in the first 18 months is they really helped with the local office with initial applications. We've seen a great deal of applications come into the childcare system. And actually, you know, they've really jumped in and been able to help with that. So it's really kind of expanded their scope of what they originally were doing, and being able to help. And really, if I just back up for a second, if you think about it, as we saw these grant recipients getting a lot of support on the front end as they came into the childcare system, we really took a step back and said, everybody should be getting this kind of assistance when they're coming into the system, not just folks that got grants, but everybody should be given this opportunity to be able to, you know, guide them through this, frankly, a complicated childcare system is what it is. Can we go to the next slide, please? So moving forward, so August, we will be launching the pre-licensing unit and providing this service to all potential providers. Okay. So we want all folks to go through the pre-licensing and get that support on the front end. The idea is that if they get all of that support on the front end, they're going to be better prepared day one to be able to provide care for individuals the first day that they have children in care. There's a lot of other benefits that I'll go over down the road when we get to that slide. So individual technical group assistance. So this is something that we heard a lot from providers. Okay, we used to do in-person orientation where there was time during that orientation to have a conversation with folks. And what it did is it gave folks an opportunity to do a question and answer and really give them everything that they needed to make the decision if they wanted to move forward in the childcare system. We eliminated that and put the orientation online. And what it did is it streamlined it, but it took away that kind of area of conversation from a potential provider and a licensor and being able to have that conversation. So really what we're doing is we're adding that back in, and we're going to do it in a group format. So when folks get done with orientation, then they will come to us for a group technical assistance where we'll be able to sit with them, answer some questions, you know, and really kind of bring back that Q&A that we lost when we went to the online orientation. It streamlined it, but we lost that. And what we heard from providers, they enjoyed that. And then licensors even enjoyed it even more because they were able to answer a lot of questions during that time. And now they were having to do that once they went out in the field to do the initial. So really, we've enhanced the toolkit is really what it is. So being able to have all of those resources at our fingertips to be able to send different things out. So having a library where if somebody in Spokane has a question about X, we're able to go give that to that individual. And we have the same resource in Seattle, frankly. So it doesn't matter where you're at in the state. we're able to compile all those resources together. Streamlining the process. So really what this is making sure that every provider is ready to provide childcare day one, right? That they understand what they're getting themselves into, and really have the knowledge that they can be successful right off the bat. Having a pre-license, so everybody will have a pre-licenser that will help them, that will assist them, and everybody will come into the system at a different spot. And then they'll also potentially have a health specialist that will assist them. Again, this is something that we've done for some, and now we're trying to do it for everybody is what we're trying to do. We can go to the next slide, please. So again, this is going over the things, and all of these things were being offered to folks. It was offered out in the field at the local office, right? So you would call up and say, I need a feasibility visit at the local office. They would deal with it. Now what we're doing is it will all go through the pre-licensing, right? So all the feasibility visits will go through pre-licensing. All the facility and site reviews, it'll be pre-licensing. We'll take those over. Site visits, they'll start doing the site visits, right? I've gotten some concerns about, well, how many people and where they're located around the state. We can do virtual site visits here, right? So the idea is that we could have somebody doing multiple visits in one day, helping multiple potential providers coming into the system, where in the past we would drive out to one site, do a visit, tell them, yeah, this might work, this might not, and then they'd get back in the car and drive back. We can reach many more providers and answer a lot more questions. And in the end, it's going to save everybody money is what it's going to do, because we're going to eliminate mistakes and getting in situations and buildings and that kind of stuff that we would other way bypass. So I'm really excited about the potential of how we can assist just virtually, having somebody that's able to do these visits, multiple visits a day, and really giving a great deal of technical assistance for folks. It's one thing that came out of COVID, that was the virtual visits didn't work for monitoring, but we're able to apply them here on the front end. So if you were one of those providers that were part of the experiment of virtual visits, thank you. We took that knowledge and we're applying it here. So again, going over the licensing process in detail, they'll give technical assistance there, accessing resources, as I mentioned, reviewing policy handbooks, reviewing all of that kind of stuff at the front end, so that is all taken care of before they're even issued a license, right? Having all that stuff and having somebody to be able to guide them through that is something that we've been trying to get our hands wrapped around for a long time. We think pre-licensing is kind of the answer to this, because we'll be able to get some template stuff for folks and provide some really good guidance here on their handbooks. So next slide, please. So again, this is just getting in the detail of some of the things that technical assistance would go over with folks, you know, and really being able to dive into some of the WACs and, you know, the implementation of them and how they will work. It's just being able to give that ongoing one-on-one technical assistance on the front end, right? When they haven't even applied yet, right? Just being able to get that assistance and really know what they're getting themselves into. Can we go to the next slide, please? So the summary, you know, pre-licensing, working with everybody that's potentially wanting to become into the childcare system, right? And then giving that technical assistance, reviewing applications and materials, and really not recreating resources, but providing those resources that are already out there in the early learning system is really what it is. You know, I think that when we thought about this program, what we are really trying to do is make sure that, we're investing up front instead of trying to fix the problem once they've already become licensed, right? And we're spending a lot of time out in the field trying to help people get up to there. Instead, we're just going to start this from the front end and just really invest up front. So I see that Susan's hand's up. Susan, do you have a question?
Yeah, I do, Travis. So, having been actively involved in searching for facilities, what part of this pre-licensing thing actually addresses the facilities licensing requirements and how to assess properties for licensability? This is because that's where we run into most of our roadblocks is that part. And then, so we've hired architects and folks like that, and we're having to pay money, a lot of it, because they're not cheap. So what part of this pre-licensing, is this just assuming you've already found a spot, or, a helping
No.
with actual facilities review?
Yes. So this is the feasibility portion of this is we will go out to a site, take a look at a site, and see if it is feasible to be a childcare, right? Like we'll get, or we can even get on FaceTime or a Zoom and assist that way, where we're actually gonna say, yeah, that's not gonna work at all, or you know what? Let's get the fire marshal in here to look at this with us and see what they think, if this would work or not. Now, Susan, I will tell you this: there's some things going on at the local level, which I think will open up some childcare stuff with coding and building code and that kind of thing, right? Which is separate than this pre-licensing. This is just offering the service that we've always offered, but I don't think enough people knew that we would go out and do some of these visits. And frankly, sometimes the field doesn't have the staff to be able to do it, so it gets pushed way down on their list, where we're putting this at the front end saying, no, this is important. We want to go out there and look at these facilities and save people time and money, because we want quality childcare coming into the system is what we want.
Okay, so like if I can just, indulge me for a second. So tomorrow I'm doing a site tour at noon, and I just found out about it today. So pretending they're, so I would contact, because we've used that King County thing before and we got no response to review sites that we were looking at. So walk me through the process. Like, I've identified a site, I'm going to tour it tomorrow. What would it actually look like if you guys were going to be engaged in it?
So what you would have done is you would have sent a message to the welcome inbox, right? And there's also a phone number you can call, that all of these are going to streamline come one area. So you would have sent that message. Then we would have said, oh, hey, they're going to go look at this place. Can we get a pre-licensing specialist out there, or even on the phone, right, to walk through with FaceTime or something to get in. I'm just saying, if we didn't have a chance to plan ahead, but you send that message last week, we get somebody out there to walk through the building with you and tell you from a licensing point of view how to look at it.
Okay. So you need a week's notice? Is that kind of what you're implying here?
Well, yes. And we haven't pushed launch on the program either.
Oh, I see. Okay. Sorry.
So what I'm saying is I love to send somebody out there tomorrow. I don't have them to send out.
Yeah.
But like if you give us notice, yes, we're going to have somebody come and help you and assist you.
Okay. When does this launch?
August 18th is our official launch day.
Okay, thank you.
Travis, question.
Yes.
I think this is wonderful because typically what happens is some of us do this informally with each other. People will call and say, I'm interested in a spot. We'll show up. We'll try to help them out if we can. But this is, much better from you all standpoint. I am concerned that from a cost perspective, if it's not, anybody could just call you then and just say, come out, show me, walk with me. I want to know, how are you all going to know if this is a serious person that is really interested in doing this or just anybody, how we make sure we don't waste the resources of the person going out because this call is somebody who's really serious about doing this, has done their due diligence, or they're just going to start using this as a way to say, come look at this building, come look at this building. I'm concerned about that. And then we end up, saying it's costing too much money. Because for the serious person who's done some due diligence, this is life changing if you all can meet them at the spot. But for somebody who's just like, I don't know, I think I want to do a childcare. Can you come out here and look at this space? I'm concerned we might get too many of those, and that might be wasteful. So how do we balance?
Well, for one, we already get those folks, right? And we have to deal with those anyway already. And a lot of times those folks, they'll weed themselves out of the process because they'll sit and then say, hey, we want you to come out and look at this again. The people that want to come into the system, they will frankly rise to the top because those are the folks that we're going to have contact back and forth. They're the folks that when they call the local office every single day trying to get somebody to move on their stuff and they're getting pushed down the list, those folks will now get a response from somebody, right? So there's going to be more of a response to those folks because my licensors out in the field, they got to concentrate on monitor visits, complaints, high risk situations. And so they push a lot of this, frankly, down on their priority list. And what we're doing is we're taking it off of their list and putting it at the front end where we have staff to be able to really tackle a lot of this is what it is. This is, I see Ruben on the screen. This is about customer service is what this is. Pre-licensing is about customer service. Bottom line, at the end of the day, we're providing a better service as you come into childcare. Is what it is. That's what we've heard from you all, that we need to do a better job.
Game changer for somebody who is serious. This is wonderful. So thank you.
Yep.
Travis, there's a question in the chat. Tanya has a question. Will each region have or has access to bilingual assistance?
Not necessarily. We will probably a lot of times be using interpretive services. We tried to recruit for some bilingual staff to be able to come in and right now we don't have it. We have licensors out in the field that are bilingual. And so we're hoping that maybe some of those folks will come to pre-licensing in the future. The short is no. That is one area, but we will use translators. We will definitely translate forms, and do what we can to meet the need. So yeah. I wish I had a better answer there. We got to, is what it is. Other questions? The other thing that I would love to do is come back and share with Judy Jaramillo, the administrator that oversees pre-licensing, and share an update as we roll this out and maybe share some experiences and that kind of thing. Yes, actually, we're going to create that. And not that, sorry, there's a question talking about a resource database. We're working on that at DCYF to be able to have those kind of resources. Yes, we're working on that. The other thing, bringing up, we're going to have better data here of also where folks are getting stuck in the licensing process, right? So, when you talk about barriers to licensing, I think there's a lot of assumptions that we have where folks are getting stuck. We'll be able to get better data of where folks are actually getting stuck, how many folks are coming into the system, falling out. We don't have that information right now, right? How many people start the application process? We can look at it from there, but anything in front of that we can't. And this is going to give us an opportunity to look at some of that data. So maybe it's coming and sharing with this group the data that comes out of this pre-licensing too. Any other questions or anything else that I can share? Ruben, did I miss anything?
No, appreciate it, Travis, and thanks for jumping in. Judy was supposed to present today, and she's just dealing with a family matter. So, like Travis said, this is providing customer service for those that are interested in being licensed childcare. So it's just something new to DCYF and to the licensing division that we're trying out. So we will be coming to this group and other advisory groups to kind of see how we're doing, right? And in meeting this need. And we want to make sure providers are prepared when they get licensed. We want to avoid ongoing initial licenses. We want to take this body of work and hand it to the pre-licensing unit, and so our 87 licensors can focus more on the existing 6,400 licensed providers we have and technical assistance and customer service. So trying this out, very exciting. We've been working on this for several months, and just to Tanya's question, and then Travis, answered it, but we try to recruit and get more bilingual staff, especially in our with our Somali culture and our Spanish-speaking providers, and we didn't have any applicants apply, but doesn't mean we won't continue to try. And again, part of that customer service is to make sure that we are meeting language access to our providers that English is not their primary language. So it is easier when you have staff that speak their language on the pre-licensing team, but doesn't mean that we're not going to meet their needs through our current contracts. And we will also continue to try to recruit more bilingual staff as well. Thank you.
Well, thanks for having me.
Thank you,
Okay,
Travis.
I'll hop in here. Oh, sorry, Marlene. I'll hop in here to introduce our next section. Just as a quick reminder, Jessica has shared the reflection survey in the chat for folks. If you haven't taken a minute to fill that out, please do so. That helps us in forming these meetings and making sure that they are a good use of everyone's time and that you get the information that you need. We are a little bit ahead of schedule, but our presenters are here, so I'm going to go ahead and introduce the next section of our meeting. As a reminder during the presentation, please be sure to type comments and questions in the chat. We will get to a place where we can answer those. And if you're unable to utilize the chat, you're welcome to raise your hand when we get to this section for questions. With that, I'm pleased to welcome Diana Stokes, DCYF's Access and Living Wage Manager. Officer, and Kristen Ramos from the Department of Commerce to share updates on increasing access to early learning and education and facility development. DCYF will cover highlights from the Access and Living Wage Plan and the EC Facilities Exploration Project. Then Commerce will provide an overview of the upcoming early learning facilities, the ELF grant, and its role in supporting DCYF's access goals. With that, I will pass it over to Diana.
Thanks, Colleen, and thank you all for being here with us today. I am super excited to be here to share this update with you all. Over the last several months, we've collected your feedback, and your insight was valuable as we put these together to form the recommendations to develop this implementation plan. So today I'll be sharing more about these recommendations and then our next steps for implementing. Next slide, please. And just to ground ourselves, I just want to reiterate that these are recommendations will align with our agency strategic outcomes, really focused on getting to kindergarten readiness and ensuring that families have high quality early care and education that is affordable and available to them all. This next slide shows the pillars of what the Universal Access and Living Wage Proviso led us to do. There we go. So if this is new to you, the proviso had really two fundamental pieces that were related to this. This was ensuring that families have access to affordable childcare where they're paying no more than 7% of their family income, and also ensuring that providers are receiving a living wage and benefits. And so I'll be sharing more about how we're building on of all the different work that's happened. But this next slide really shows all the work that's happened over the last several years, including the implementation of the Fair Start for Kids Act. We are at the end of this timeline specifically as we are getting ready to share the full legislative report with legislative staff, community partners, advocates, various advisory groups, and providers. And so today you'll be seeing these recommendations that we are putting forward. This next slide connects on how we are connecting this integrated mixed delivery system that's really important for all of us to achieve. In order to get here, we're building on existing efforts and frameworks such as the Child Care Collaborative Task Force, the Cost to Quality Care Rate Model. You heard Matt talk a little bit about that as he talked about the Cost to Quality and Market Rate Survey, as well as the Early Learning Coordination Plan. Most importantly, continued implementation progress of the Fair Start for Kids Act is the foundation of the Early Care and Education Access and Living Wage Implementation Plan. So this implementation plan will serve as our roadmap of how we get there, including subsidy rates that pay providers what it costs to provide quality care, and that more families are able to access subsidy and ECAP programs. Next slide. So in addition to highlighting the progress of the Fair Start for Kids Act, the full implementation plan also acknowledges the impact that we had for the 25-27 budget session, including delays to expanded Working Connections childcare eligibility and ECAP entitlement. This report also includes the recommendations to achieve the proviso's goal, where families are paying no more than 7% of their household income for care, and that providers are paid the living wage and benefits. It highlights the resources needed by DCYF to support implementation, such as FTEs for licensing and others, as well as any administrative changes that will be needed. These recommendations highlight a phased-in process for implementation over the next years, contingent on the investments made in each legislative session. And then additionally, modeling was completed to support the cost analysis of these recommendations. While these are not included directly into the plan, It will be made available upon request, and we're working to ensure that these numbers are in plain talk and more understandable for everyone to use. So over the next several slides, I'm going to share the specific recommendations. As we move forward, these recommendations are categorized into 4 goals. Families have access to high quality ECE that meets their needs, supporting a thriving early care and education workforce, leverage data and aligned systems, and adequate facilities for expansion of the early care and education system. When you see the full implementation plan, you'll be able to read about each implementation strategy, including why implementing that particular recommendation is important, as well as how we propose to implement these recommendations, including timelines for phased implementation. So as you can see, this first slide here is highlighting goal 1. So families have access to high quality ECE that meets their needs. I'm not going to read off of these specifically. So we have a goal, we have objectives, and then we have the strategies of how we're going to be working, where they'll have more of their supports in there. So the first objective really connects where we're wanting to go with this work, where we can create a child care guarantee for all Washington families who need and choose to access care. And this really connects to working connections, having a co-payment scale, and then how we make sure we align with current CCDF rules. The second objective of this goal is focused on reducing barriers and promoting equitable access for families. So this goes and connects to approved activities for working connection, how we allocate our resources for education and outreach to families, and how we think about an application and eligibility determination process that is supported in multiple languages. The third objective for goal 1 is increasing access to before and after school care, summer and evening and weekend care. Throughout the engagement with families and providers, we heard really the need for non-standard hour care. A lot of this care is happening right now with our family, friend, and neighbor care providers, which is great that they have found access. But we also are thinking about what are the rates for those receiving working connections with family, friend, and neighbor care, and then thinking about how do we support quality improvement support for school-age programs, and then expanding the rate enhancement for those offering non-standard hours care. The next objective is focused on supporting inclusion of children with special needs. This is a topic that you will find throughout the recommendations in many different ways. For this objective, this is thinking about the special needs rate and presumptive eligibility, thinking about access for resources for providers who are caring with children with complex needs, and thinking about how do we expand support and coordination between programs for special needs care, minimizing the disruption of children. And this also is thinking about the resources that are available through OSPI and our K-12 system. As we transition into goal 2, I know this is one that is very popular with our providers, and it's ensuring that we support a thriving early care and education workforce. Without, we can't increase access to care if we don't have the educators in the classroom. So our first objective here is to make sure that these workers are receiving living wages and benefits, honoring the work that they do. And I just want to tie back that this connects to the survey that Matt talked about, because we want to transition to using the cost of quality care rate model. So that way working connections rates
really do reflect the true cost of high quality care. And then additionally, having a wage scale that is focused on the workers and different bands that allows flexibility for employers. And I do want to highlight that this is something that would not be managed by DCYF, but would be done in partnership with L&I, as we do not oversee wages. This next slide, I apologize. There's a lot of words, so the text did get smaller, but I wanted to keep everything together for this one objective. And this is in regards to supporting childcare providers to meet requirements and deliver the high quality care that families need. This includes how do we support infrastructure needs as we deliver provider support services, ensuring that things are available in home languages, thinking about community-based, linguistically and culturally aligned professional development and resources, promote equitable access to grants, enhancements, and incentives for providers, thinking again about working with children with special needs, what are the resources and professional development opportunities needed, ensuring that we streamline access to information and resources. That is not specific to professional development, but just any resources that are made available. And to have a continued partnership with the State Board for Community and Technical Colleges and higher education institutes as we look to increase access, navigation support, and have innovative practices to meet the needs of our diverse and growing ECE workforce. Objective 2.3 is really focused on increasing relational health and infant and early childhood mental health support for children and providers in diverse settings. So while Nicole mentioned that there was some budget reductions here, we still have a foundation that we can build through early achievers, and we'll continue to explore additional strategies to meet our community needs. Goal 3 is about leveraging data and aligning systems. So this is ensuring that we are using high quality data to guide decisions and increase accountability. You heard Travis even talking about the data that they're going to be receiving with the pre-licensing unit and how that will inform this work. So this also will connect to our early learning dashboards that Matt and Melissa shared earlier, and that we're using those to communicate needs and evaluating of what is the story that we hear through the dashboard. We want to support and enable integrated and inclusive classrooms. So knowing that many programs serve different childcare types, such as licensed childcare, ECAP, Head Start, and transitional kindergarten. How do we support individuals with being successful with navigating the different standards for each program type? And then additionally, we want to make sure we're pairing new resources with accountability to support high quality social justice and anti-judgmental implementation of programs and resources. And so we really want to support a culture of respect at our agency and really supporting the professionals navigating the state system and all the different pieces that they have to navigate through all of that. And then lastly, goal 4 is ensuring that we have adequate facilities for expansion of the early care and education system. Without having the right facilities available in the right communities, accessing what the families need. We can try to increase childcare, but without some facilities, we won't have the space to do so. So one is making sure we maximize the capital budget investments for the Early Learning Facilities Fund. You'll hear Kristen from Commerce talk about that opportunity here very shortly. And this also includes expanding grants, loans, and technical assistance for programs to meet their health and safety requirements, preserve existing capacity and expanding access. And there were additions in this last legislative session to really focus on health and safety with a new grant program with Commerce. And then additionally, and I'll share more about this one very shortly, is exploring and implementing new approaches to meet the long-term facility needs to scale access for children and families as identified in a project that is currently on its way. And this will really focus on what are the resources and how do we implement a comprehensive strategy for expanding early learning facilities, ensuring that there are a robust support services, again, like what Travis was talking about with the pre-licensing team and making those connections and other services that DCYF has available. I'm just monitoring the chat, but it looks like Nicole is on it, so I'll come back to that here momentarily. But as we transition to the next couple of slides that I have before I hand it off to Kristen, I wanted to highlight a facilities project that we're currently doing. So as we are exploring the facility needs throughout Washington, we are really focused on what is it that we need. So the primary objective for this project is to deliver a report of analysis and recommendations for the development of not just an implementation plan, but an actionable one that is related to technical assistance, identifying startup support, and other items that have been identified through opportunities of engagement so far. And this is directly connected to that goal 4 that you saw with the connections about ensuring adequate facility for expansion. Through this objective and through this project, we're really looking at, what spaces are available, what are the things we need to think about, how do we make connections with different agencies, and then how do we look at different buildings that are available versus what are the costs for a brand new building. And so we're also looking at local jurisdictions and the differences between what are the different ways of defining childcare, where many of them define it as daycare. What are the different zoning requirements, permitting and costs, and really looking to understand the local challenges with this as people navigate this. We've also looked at what other states are doing and how are they expanding and investing in facility development for childcare. So more to come. This project will be wrapped up by June of next year, and we'll be sure to share out more pieces as they come available. This next slide highlights the overall timeline for this project. We are contracting with Burke Consulting, and they are well underway with the work that they've been doing. They have developed a catalog of facility investments, including ELF grants and other efforts in Washington since 2015. We're looking at, again, how other states and municipalities have approached the facilities retention and expansion. And this was all identified in a literature review. We have a work group that is convening. That I'm not going to call on Lois, but Lois is representing ELAC as a member of this work group meeting. And so really appreciative of all the participation and feedback that has been provided so far. And then we have connected with ITEL, ELAC, and provider support to better understand personal experiences. And we continue to connect with providers specifically to learn about these. Currently, we're working on a facilities need and financial analysis. And this is really looking at what is the cost of developing a child care program from initial development of a facility, and how does that change, and where does that, what is the dollar amount that comes down to, per slots versus child, because you can separate those out depending on care needs. And then this will all feed into final recommendations that will be reviewed by the work group prior to being published and made available. And again, all of this is expanding our roadmap that's been outlined in the Access and Living Wage Implementation Plan. This next slide is just a very quick reference. I'm not going to read through all of this, but these are the individuals or organizations that have been invited to participate into this work group. So we're really looking to have a diverse group, and we're also connecting in smaller groups with other entities such as the State Fire Marshal, Department of Health, and other entities as they connect to our ELAC and facility development. And before I jump into questions, I would like to just highlight our next steps for moving forward. So we are in the final stages of getting the implementation plan out to legislative staff and others. So super excited to be sharing that out shortly. And then this will go out to partners, agency staff, advocates, etc. In the coming weeks as well. As this plan is using a phased implementation approach, the cost modeling is being designed in a more digestible format. So once this is available, the cost modeling can be made available upon request as well. BERC is continuing to schedule individual and group interviews for those that are interested in sharing more about their perspectives, experiences, or if anybody has questions related to the facility development for early care and education, we would love to hear from you. Additionally, stipends are available to help compensate you for your time. So if this is something that you're interested, I'll be sure to drop my email into the chat so that way we can get you connected with BERC. And then additionally, as we continue this work, DCYF will continue meeting with Child Care Aware Washington and SEIU 925 monthly to discuss things such as our communication strategy, outreach, progress on implementation, and other things related to the implementation of this plan. And then we continue to work with BERC as we continue this facilities project, and we'll connect that to the Access and Living Wage Plan as that is finalized. Recognizing that we have a 10-year roadmap, we don't want to just provide this legislative report and be done. So we are committed to sharing status updates every 2 years to identify the progress that has been made, identifying any changes and investments made each legislative session, and any refinement of implementation strategies that are happening throughout those 2 years. And so with that, we'll have those updates regularly available and hopefully be able to come back to ELAC to share those directly with you all. But I do want to really share and say thank you for all the input that you all gave previously, because it was so informational and supportive of developing this implementation plan. And we are committed to keeping you all and other community members and partners aware of our progress and are looking for opportunities for continued engagement and feedback from you all. So with that, before I hand it over to Kristen, are there any questions? Oh, Susan, I see your hand.
Yeah, I didn't see anything like architects or developers or real estate agents on that work group, because it's a very important and a missing link in the data and the information that you'd be collecting. Because I can tell you right now, having been looking at this for the last 7 years and looking at properties, you're looking at $400 a square foot to renovate a new building, to make sure you have the plumbing, all these kinds of things. So I really encourage you to look at folks like Environmental Works that do a lot of advising, like they advise Kids Co on our search for licensable space. We work with CBRE, the real estate company, to identify locations. And they, I mean, there's are there any contractors who have to do, who've done this work? That is an incredibly big gap in the people in your work group that I would encourage you to evaluate adding some of those types of folks, because otherwise SEIU, childcare, where none of those people can inform you about the whole facilities needs and barriers because they don't do it. So that would be my feedback, and my highly encouraged opportunity for you to fill that gap.
No, and that's helpful, Susan. We do have Environmental Works, which is a architect firm, as well as Design for Early Learning. So I can take that feedback for this slide, and instead of just having the entity, you know, who's made up of that, you know, what are they representing? That could be a helpful connection there. And then we are working to connect with other professionals as well. They're just not directly connected to the work group, but I do appreciate your feedback, and I agree. That is a voice we definitely need to be listening to.
Yeah, because they're the ones we have to pay to do the work. Thank you.
Yep. Yeah, no, of course. And just to highlight too, because I didn't talk about, you know, what we hope to have as an outcome of the facilities work, but we are really looking to support what do providers need when they're working with these different subject matter experts, but then also what do these subject matter experts need when working with childcare providers? So we're really looking from both perspectives of how do we understand each other and our different lingo to ensure we're getting to the same thing. Just because, you know, square footage means one thing as a builder, but when it comes to licensed childcare spaces, the usable square footage is completely different. So we want to make sure that we are identifying those pieces.
Yeah, and we're also
Any other
to look at, when you're looking at cost per square foot, you also have to look at years of how much investment and when your return on that investment becomes real, because that's impacting, for instance, loans that might or might not be available. So the picture gets really big, and the bottom line is right now with licensing the way that it is almost impossible to find a building that you can afford the lease rate that has enough square footage for you to have enough children to generate enough revenue to cover the cost of operating the business, never mind paying back any loans you might be able to get. And grant support is absolutely necessary. Because we're looking, all the buildings we look at, just for example, we're looking at $3 to $5 million of investment in a building we don't own that we'd have to lease. And that's not something our board is really excited about, you know, taking our resources and just plunking it in something like that. So, but I applaud the work, and I look forward to it influencing some real positive movement in this ability to open centers, because right now it's super hard.
Yeah, absolutely. And Susan, you're making a lot of great points. So if you're open to it, I would love to get you connected with Burke so they can hear your experience and kind of use that to help inform recommendations and have that input brought to the work group meetings as well. So if you're interested, let's connect.
Yeah, feel free, no problem.
Okay, absolutely. Any other questions? All right, well, if there's no further questions, as we think about the importance of the funding opportunities to support facility development, I am going to hand it off to Kristen Ramos as we talked about expanding and using the most of the Early Learning Facilities grant program. She's here to talk more about this grant program and the opportunities available with it. So Kristen, I'll hand it over to you.
Hello, everyone. I'm going to make this as easy as possible. This is our team that you see on the screen. Go ahead and go to the next slide. We'll get to the meat and potatoes of this real fast. Basically, we're the Department of Commerce, and we help strengthen communities through a variety of different programs that we offer. In particular, the program we have is the Early Learning Facilities Program. Next slide, please. This is our team right now. We have a new addition, Mary Harding. She started on July 1st. We also have our other program managers that are going to be working on this next funding round, and that's Juan Aguilar, Amy Gutierrez, Stephanie Honhorst, and Katrina Matson. And my current boss is Leslie Wolf. So your successful applicants will have one of these program managers helping you out from start to finish. Next slide, please. So basically, the grant funding from the 25-27 capital budget, we're going to have roughly 47 million for expansion. And by expansion, we're looking at subsidized slots through intended ECAP or Working Connections childcare. And then we also are going to have money set aside, and that's about a little over 7 million for maintaining capacity. So that's where we're going to see a lot of our family homes applying, because most of the family homes are pretty much capped out at their maximum. So they're going to need funds to maintain what they have. So we anticipate a lot more family homes applying for the maintenance funding and a lot more of the facilities applying for the expansion. Next slide, please. The timelines, roughly the fall of odd years, that's when we open up the expansion and maintenance grants. And then spring of even years are the public school districts. And for this next funding round, the public school districts will also include tribal compact schools. Next slide, please. So here's our anticipated timeline. We're super excited. We're going to open up our grant on September 1st, and it will close at 5 p.m. on October 31st. So that gives people, a good chunk of time to get their application together. And right now, everything is updated on our website, the program guidelines, the notice of funding opportunity, the schedule for our brand new session, which we're having live office hours. I just put the website link in the chat as well. This program presentation is also already on the website, along with notes, transcripts from when we recorded it with our team, and frequently asked questions. And they're also translated into Spanish and Somali on our website too. The next slide, please. This is the schedule for our office hours. The links on our website are appointment specific. So if you want to come on to the very first one, click on the first link. Don't click on the September 23rd link because it won't let you in. So the August 26th, click on where the morning or the evening session, and it'll take you right to the correct room. And we will have a live person to answer questions. If you run out of time during that session, you can email the Early Learning Facilities website, or I'm sorry, the email address, and someone will get back to you within 2 business days. We are having to follow the time very closely. So they'll start on time and end on time, because we need to be cognizant of our team members' time, especially when they're doing those evening hours, because that's outside of their regular work schedule. But we'll have live assistants to answer questions, and recommend that people review the materials before they come on to ask questions, because 99.9% of all questions are generally already answered in the documents that are on the website. But there are outlying situations where we're more than happy to help. Next slide, please. We have some great news for this funding round. There is no match requirement. All right, can we have a couple cheers for that? People are super excited that there's no match requirement. Also, we're not going to securitize grants less than, all right, love it. No securitization for grants less than $250,000, and that will make it so much easier for the smaller organizations and family homes. They will be requiring the 10-year commitment still, because The funding for this program is from taxpayer dollars, and we need to see that return on investment. So we don't want people, updating their child cares and then turning around and selling their home for a profit before they've actually provided care for a designated amount of time. So there is still that 10-year commitment that would be contractually adhered to. We will have both rounds that we used to separate previously into one. So there'll be a part for the maintenance and a part for expansion. So people don't have to worry about I missed my funding round, because they thought it was coming up. We're putting everything into one. So it'll be really easy. And for this year also, there is no cap on the funding request. However, if somebody requests $8 million, they need to support that request with bids, estimates, real estate comps, something like that. They can't just say, oh, I want to open a daycare. I want $8 million because that's how much I think it's going to cost. They have to support it and have a strong application. Next slide, please. So just a little definition here. Expansion is additional capacity and maintenance is necessary work to keep the existing slots in service. So that's how we're looking at it. Next slide, please. This looks a little convoluted, but I promise you it's actually pretty simple. So if people are thinking, well, what do I apply for? Well, are you a facility or are you a family home? And then you go down, are you expanding capacity or are you maintaining capacity? And then what stage is your project in? And we actually have project development slides on our website that'll help potential applicants determine which type of funding to apply for. Is there more weight to one category or no, we basically score on project readiness to see how, are they really ready for funding? And honestly, if an applicant is starting from square one, we highly recommend they start with pre-design or pre-development. We had a grantee that did start with that 2 rounds ago. They got awarded. Then they applied for construction on this last round 2 years ago, and they got awarded because they followed the sequential steps. They didn't just go from 0 to 60 and say, oh yeah, I want to open a daycare. It does take time to open a daycare. So they started from the beginning and worked their way up. So there is no wait. We just look at how ready the project is for funding. Next slide, please. This is where it gets fun. We have a tool on these slides so people can use their phone, go to the QR code, and takes them to a Survey Monkey. And they just answer a few questions, and it helps guide them to what type of funding is most appropriate for their project. And so far, we've had 113 completed surveys. We don't track the data. It's just a tool for potential applicants to use. And these slides are on our website right now. So it's called the presentation. So if you go to our website and you look for the presentation slides, it is, slide, well, there's a thumb up on that number. I can't see what the number is, but this is already there for you to use. Next slide, please. So here are the expansion funding categories. You have pre-design, pre-development, and then the big one, which usually takes the biggest chunk of money, and that's the major construction, renovation, or facility purchase or acquisition. We do have minimum requests for each category, but there is no maximum right now. And this will help guide people into where am I in my project? So do they have an idea? Do they want to open a daycare? They have an idea. They'd probably recommend pre-design. They have an idea, they are doing the architecture and engineering work. Yeah, they're probably more applicable for pre-development. But let's say they have all that work done. Yeah, they're ready to go for construction. So it's kind of sequential in the project development. And next slide, please. For the minor renovations, we used to call it minor renovations for health and safety, but we now just call it maintenance. We have a minimum request of $10,000, and $10,000 really doesn't go as far as it used to. So it's only for the early learning, the licensed learning space of the building, whether it's a center or a home. And we had some challenges before where, a family home would need a roof. Well, we would only do repairs and not replace systems, but we're going to kind of do a compromise here. If they need to re-roof their whole home, we would prorate it as, if the home is 2,000 square feet and the early learning is licensed for 1,000 square feet, the grant could pay for half. And then they would have to contribute half. It's not considered matching, it's just their contribution because the grant funds can only go to the licensed portion of the property. Next slide, please. So here are the early learning facilities requirements. So the commitment period. Oh yeah. I'm sorry. Yes, the maintenance grants are available to centers as well, centers or family homes. Yes, that's for facilities, whether family homes or centers where they're not expanding capacity. So yes, the commitment period is 10 years. The project must be fully funded, and that means if for some reason the project ended up costing more than the request amount, they would need to bring that amount to the table before they would be able to be under contract. With the fact that they don't have to have a match, as long as they have a budget that matches their request, that shouldn't be an issue. Grants that are over $250,000 will be secured with real estate. So leasehold deed of trust or a deed of trust, and they'll work with our securitization team to get that done. They must comply with public work statutes. So you need to check with L&I to see if your project would be required to pay prevailing wage or have apprenticeship requirements, and that type of thing. So you need to work with your contractor with that and consider prevailing wage with the bid estimates. We do require insurance, commercial property, commercial liability, and fidelity. If it is a construction project, you can do builder's risk because there's no building to insure while it's being constructed. So we can be a little flexible up that. This is a reimbursement grant, so there's no funds provided up front. We do not give money for deposits on work. It has to be completed work. And we do realize that there are cash flow issues, especially with the smaller organizations. So what we've managed to be able to do is, let's say there's a small business, they're putting in a playground. The contractor does the excavating and framework for the ground service. They invoice for that piece. The grantee would send the invoice or the reimbursement request in. We'd give them that money for that invoice, and then they'd have 30 days to provide proof of payment to that contractor or vendor. So that way they just do project in pieces and they don't have to worry about out of pocket. And we do this for the smaller organizations where they don't have a lot of cash flow. As long as that piece of the work is completed, we'll help them out that way. We will require site security and authorization to complete the project. So if the property is being leased, the lease has to stipulate that there is permission for the person leasing the property to make modifications to that property. We had a couple of situations in the last round where the landlord had no idea the person applied for the grant. And then they ended up having to return the funds. And we do not want to return funds. We want to make sure these funds go out, get used, projects get done, and everybody's happy. They need to be enrolled in Early Achievers or Love It Way. And we do understand that there is a time gap. It takes time to have an Early Achievers program, but so they must intend to, and within a couple of years, we will be following up to make sure that was actually done. And for tribes, we will be accepting Love It Way in lieu of Early Achievers. They also need to be in compliance with Governor's Executive Order 2102, which is the cultural and historic preservation. So they would need to make sure their property isn't a historical property, or they need to follow in the guidance from DAP, which is the Department of Archaeological and Historic Preservation. And if awarded, we have program managers that will walk everybody through all of these processes. So please don't think you have to remember everything. Each awardee will be assigned a program manager, and they'll help them through all the processes here. And the governor's order, executive order 2102, also includes tribal consultation with potentially impacted tribes for any type of ground disturbance, because we've had people say, oh, I'm only putting in a fence, I'm not disturbing ground. Yeah, you kind of are when you're digging those fence posts. So we'll help you through that process as well. Next slide, please. Oh, and thank you, Rose, for the clarification. So developing a budget. This is key. You want to make sure that the funding request is fully supported by bids or estimates, that your contractors are considering the prevailing wage requirements, and also think about potential cost escalations, because we've seen a lot of cost increases that weren't planned on, and then you have this funding gap, and the grantees are saying, well, what am I supposed to do? And like, well, we always award out every dollar available. So they'd have to get a loan, they'd have to go into their savings. So take these into consideration when they're developing their budget. Next slide, please. So this is the fun part. We get to share some completed projects. Lumen Early Learning Center in Spokane is an early learning center for the children of high school students at Lumen High School. And this is in downtown Spokane. So you're in the middle of the city and you have this project going on. So they had 60 initial slots, and they have an planned expansion to 120 and 100% subsidized through Working Connections childcare. And we actually toured this last summer, so I was super excited to be there. On the left is an indoor garden area. So they have little plants growing right by the windows, and right outside that window is a public sidewalk. So people are walking back and forth outside this night looking, hey, it's a daycare. They also have the school age classroom upstairs for some of the older kiddos. Next slide, please. Upstairs, they have this toddler play area, and I don't know if you can see it from the picture, but on the stairwell, you'll see several different railings. So little kids, a little bit taller kids, they each have a size appropriate rail to hold on to as they go up and then go down the slide. So they have indoor play areas for these kids. They also have a right-sized bathroom for each grade level, and it was just a super cool project. Next slide, please. But wait, there's more. The kitchen area also shares space with the high school educational area. So on the other side of the room, it's open area, and they take out tables and chairs for some instructional use as well for the high school students. They recently acquired some more space in the building, and that open space there is going to be a school age play area. So that's where they're hoping to expand in that space. And next slide, please. And I'm going to pause just a second. Okay, super specific question. Yes, we have heard change use from cities. We had a project, Triumph Treatment Services. No, it wasn't Triumph Treatment Services. It was it was in Olympia, and they thought they had their project all paid for. And then City of Olympia wanted them to do a use change, and it was like $500,000 to put up street lights, access, road studies, traffic things. This would probably be part of their pre-development information, so they'd want to check with their cities ahead of time before they applied for the big construction part. So maybe after we're done here, if somebody else has anything to add to Danya's question, that'd be great. Okay, so this one here is super cute. It's a family home, and we were super impressed with what they did with such a little amount of money. And yes, $76,000 does sound like a chunk of change for a family home, but they did a lot. They updated their windows to be more energy efficient because Yakima gets hot. Energy efficient windows. They had very little counter space and food prep space, so they updated their kitchen. Lots more food prep space, new appliances with the double oven. And trust me, I went from a single oven to a double oven, and yes, it makes a huge difference. And it was just so welcoming and such, much more sanitary. They also did new flooring. Next slide, please. They had little right-sized tables and chairs. They had a covered plate. They covered their back area. You could also see where a lot of those writing toys have been so faded by the sun because it wasn't covered. But now they have a covered area to play as well. And in the left picture, you can also see part of the prep space where they added a peninsula on the side where they actually have more space for their food prep. But lots of care went into that home. Very much pride of ownership, pride of their childcare. It was just really an impressive project. And I just wanted to highlight that as well. Next slide, please. If you want to be notified for the release of other programs or just be on the mailing list when new grants are available, we have email notifications on our website. So you can subscribe to any number of programs that Commerce offers just by going onto our website, going to this section on the right, about 2/3 down, I believe. And then you can select which programs you want to be notified on. Next slide, please. That is it. I know I dumped a lot of information on you. I would just check out our website. Everything is on our website. We've got the program guidelines, notice of funding opportunity, which, by the way, as an attachment on the back, are all the questions that will be on the Zoom Grants application. It also has an attachment, how to write a scope of work, an attachment, how to develop a budget, lots of helpful tools that have not been available in the past, but are available now because each funding cycle, we just try to improve. We listen to the comments, we try to make it better. And we're really grateful for our partnership with DCYF too. Diana's been so awesome with helping us improve things as well, and Tracy and everybody else on their team. Any questions for me? I know it was like a fire hose. I apologize.
Question. If you continually get, and this is personal, the last 3 rounds, we're not sure why we're coming up short. Is there a way to find out what your point system is or what's happening to make you come up short for being selected?
Yes, after each funding round, we have a debriefing webinar, and in that we list the most common reasons that projects were not selected for funding. And honestly, the biggest part is that we run out of money before we run out of projects. And even though we have a lot of funding available, we have more funding this round than we have in the history of the program. We'll be able to fund a lot more projects, but the biggest issue is we run out of funding before we run out of projects, but also project readiness. People have some of these applications, they're just not ready to be funded. We look at the project in 2 ways. One, how many points were scored, with the percentage of points earned compared to the points available. And then also with our external review team, as an overall view, do they recommend the project for funding or they don't recommend the project for funding? So usually 80% or higher and no votes against funding. So that's the criteria we use for the project. And for this funding round also, we do not have a pre-application. We just have the one application just to make it easier on everybody. So everybody can proceed to the full application because there's just the one application. So we're really trying to make it easier on all the applicants. That was a very good question.
Thank you.
And I'll just add to, this is where our services with Imagine You can really support. So we partner with Imagine Institute, my apologies, to provide technical assistance support. So this includes language access, and we're really looking at how can we support people to be more successful with submitting their application. And so this is a continued piece that, as we think about quality improvement, how can we expand these services to ensure that more people are ready? And I agree, Angie, with what you said. It's really important to understand that difference so that way, because this is a great funding opportunity, what is needed for that. And I would say too, if there's questions about that from the program standpoint, with ECAP and early achievers, please make sure that you're reaching out to DCYF, and Kristen and her team can talk about the application and all of those great things. But what's really fantastic about the reason why this early learning facilities program really started was to support DCYF with our access goals. And so it does feed into, where we're trying to go with that access and living wage implementation plan, and why it's important to continue investing in ELF so that way we can support these programs. So again, I really appreciate Kristen, you sharing about this opportunity for childcare programs and, the connections with enhancing and expanding access to working connections in our ECAP program, which again will help us support getting to ECAP entitlement as well. So I'm not seeing any other questions in the chat. Do we hand it back over to you, Marlene?
Yeah.
Or Dr. Ryan Knowles, is that you?
Yep, it's up. I'm up. Hi. Thanks again, Diane and Kristen. Really good information, and I appreciate the enthusiasm. Remember to share feedback via the meeting reflection survey for this topic and any of the other topics discussed today. If you haven't taken the time, please fill those reflective surveys out. They help improve the work that we do. For closing remarks, I just want to thank everyone for being present and engaging in the information discussed today. It was a lot of information, but very meaningful to the work that we do. As a reminder, our next public meeting will be Tuesday, October 7th. And thank you all for joining us today. Please enjoy the rest of your day. We're going to let you go a little bit early, but thank you all again for your time and engagement.